Greetings. I am going to be recording my portion of the study guide, Miss Candler's part. So you'll need to get your study guide and go to the part that says Miss Candler's part. On Miss Candler's part, it says the Enderkin 14 questions. Know the signs and symptoms of tetany. Pretty plain and simple. The tingling, the numbness, the weakness, da 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 da. Complications of high blood sugar. We talked about the difference in the macro versus the macular vascular. So micro versus macro vascular complications. The levels of prevention. Secondary. That's right. You should have been thinking screaming screenings right back at me. So primary was when we try to prevent something from happening. That would be like infant car safety, safety checks. That would be, for example, immunizations. And secondary is screenings. And tertiaries would be once they have it and you try to make them get better. So someone who's had a stroke who's going to rehab would be an example of tertiary. Patho of diabetes. Make sure you know the difference between type 1 versus type 2. Drugs used for precocious puberty. I know what you're thinking. What's precocious puberty? Go back and review. If you go back and look in your notes, you will find the answer. And there's one particular one I'm looking for. It starts with an L. All right. Growth hormone excess in adults. What did that cause? And what was the signs and symptoms of that? Drugs used for diabetes insipidus. Go back and look at what diabetes insipidus is in case you've forgotten. And what drugs did I particularly talk about? Check for bleeding after thyroidectomy. Okay, thyroid, large bandage, coming to about right here. So where would you think it might trickle under? And I would probably need to check the back of something. Differences in Trousseau's and Chbosky sign. Make sure you look at those and remember them. Know the differences in the G words. And if you don't remember the G words, glucose, glycogen, glucagon, glycogenolysis. So make sure you go back and look at all your G words and make sure you know the meaning of them. Know the compensation for DKA, diabetic ketoacidosis, puts them in metabolic acidosis. So how would you compensate that with the respiratory system? Signs and symptoms of diabetes insipidus. So if you've forgotten the signs and symptoms of diabetes insipidus, you better look her up. Insulins. Know the onsets and the peaks. The onsets and the peaks of that insulin chart I gave you. Under respiratory, there will be 8 questions. The signs and symptoms that pancreatic enzymes are not working. Hooting and tooting. And a lot of it. Foul smelling. Yucky. So you need to check for that. Testing for RSV. How did we do that? Cardinal signs and symptoms of respiratory distress, including the earliest manifestation. Hope you automatically remembered restlessness, but make sure you know the others as well. Fat-soluble vitamins in children with CF. What's the fat-soluble vitamins they have to have them? Why do they have to have them? Post-operative care following a TNA. So go back and look at post-operative care following a TNA. Signs and symptoms of acute otitis media. So when we look in the ear, instead of seeing a gray pearly membrane with all of the cone of light and the bony landmarks, the umbo, the manubrium, and the short process of the malleus, what would you see if they had acute otitis media? Care of the child suspected of having epiglottitis. I believe some of you may have missed this one the first time. Epiglottitis is considered a medical emergency. We never, ever, ever put anything in the mouth. Right? Because we can make them have a complete obstruction, and we never ever send them down the hall for an x-ray. We always do a portable because they could go to a complete while they're going down the hall and you wouldn't have any equipment available. Peds Neuro. Last but not least, 8 questions. Positioning of a child with myelomeningeal cell. How would you position a child after they've been born and have a myelomeningeal cell? Signs and symptoms of hydrocephalus. Make sure you know those signs and symptoms. We've talked over and over and over about them. Know how to figure an IV drip rate. Amount of solution times the drop rate divided by the hour in minutes. CSF results. Cerebral spinal fluid. What's the difference if it's bacterial versus viral, and how would you tell? Make sure you go back and look at that. Nursing interventions with Rye syndrome because of the liver involvement. You wouldn't want to give rectal TENS. If you had to give IM injections, which you don't unless you have to, but if you did, you'd use special precautions. Nursing care of the child with meningitis. Know the difference between the care if it's viral versus bacterial. Now, we had this on Select All That Apply. What would be the things you would do for the care of the child with viral meningitis? And do you want to know? About 70% of you picked give them antibiotics. That's bacterial. So make sure you read each stem carefully. Make sure you read each question carefully before you pick your final answer. Best of luck. It has been wonderful having you in class this year. I've enjoyed it, and I wish you only the best in all your future endeavors. Thank you.